All right, let's bring in Dr. Ebru Salcioglu. She's a clinical psychologist at the Center for Behavioral Studies and Therapies. She joins us now live from here in Istanbul. Ebru, good to have you on the show. I know that you're watching our special coverage. You heard and saw the stories of children like Baran and Abdul Kadir, but these are just two of the hundreds of thousands of children that have been affected in the area. Talk to us about some of the long-term psychological effects of after a disaster of this magnitude.
Yes, thank you for having me. Well, devastating earthquakes lead to chronic psychological problems, most notably post-traumatic stress disorder, PTSD in short, and depression as well. PTSD is characterized by re-experiencing of the earthquake-related events in the form of intrusive memories, flashbacks, nightmares, intense emotional and physiological reactivity to reminders of the earthquake, and avoidance of these earthquake-related memories, emotions, and reminders. Also increase arousal, such as irritability, hypervigilance, concentration problems, sleep problems, so on and so forth. So an array of problems. Research shows that in earthquake-struck communities, the prevalence of PTSD and depression may be up to 50%. So this means that 1 in 2 people would experience one of these psychological problems, if not the both of them. And we know that as the level of devastation increases, so do the rates of these psychological problems. So in the region, I would expect a lot of people suffering from these psychological issues. However, probably the most more pervasive than PTSD and depression is probably fear of earthquakes and phobic avoidance of earthquake-related cues, such as, again, reminders of trauma and some situations that heighten sense of threat to safety, not realistic threat, low probability threat. So we would expect a lot of anxiety disorders, substance use disorders, perhaps. And in the coming years, we will be seeing a lot of prolonged grief reactions because within the first year, it is normal to grieve. But, after traumatic events such as the earthquake that happened in that region, many people will develop prolonged grief reactions that will persist for years.
Ebru, I want to ask you this. Talk to me about the recovery process and how it differs between adults and children when it comes to PTSD, depression, overcoming phobia, anxiety disorder. Is it different for children?
Actually, as an adult, PTSD is among the most common psychiatric outcomes of exposure to trauma in children as well and adolescents. They may a little bit look different in the symptom profile. For example, children may show some form of repetitive and compulsive play that represents part of the traumatic event or reenacts trauma, or constriction of play that may be indicative of loss of interest. But other than that, many problems are similar, especially the symptom manifestation in older children and adolescents more closely resemble that in adults. So earthquake-related fears and avoidance are also pervasive in children. So when we look at how they recover from trauma, actually, of course, we know that there are some natural recovery processes that are ongoing in the earthquake region. So some people recover in time by themselves, naturally, taking the appropriate action. But we also know that these problems are chronic and they persist. More than 1/3 of people with an episode of PTSD fail to recover even after many years. So this is an important finding in the literature. So what we need is a specialized treatment for earthquake survivors in the region. And the evidence in the scientific literature is pretty clear about the kind of treatment that should be chosen for survivors. The current guidelines for PTSD strongly recommend cognitive and behavioral therapies as the first line of treatment for trauma survivors. Any other treatment, including pharmacological treatment, has limited effect in trauma survivors. So these treatments are important because they teach people how to confront therapeutically the reminders and cues that they avoid because of the earthquake they've been
Okay.
exposed to. So by teaching them these appropriate actions, we can expect a lot of recovery that is long lasting in so many people.
And we hope that for pretty much everyone that's been affected. Ebru, some really great insight. Thank you very much for joining us here on our special coverage. Ebru Salcioglu.
Thank you very much.